So what's on the agenda for today? We're going to start off with the definition of chronic homelessness, move on to eligibility, then cover some documentation requirements, and then we're going to end it with some best practices and tips for making sure that eligibility documentation is in place and accurate. We'll start off with the definition of chronic homelessness. So in 2012, HUD published a final rule that laid out the definition of homelessness along with the 4 categories of homelessness. HUD then later published a separate rule addressing chronic homelessness. This applies to all CoC funded projects, and recipients must comply with the rule for all program participants admitted after January 15, 2016. Permanent supportive housing projects can either dedicate beds to or prioritize serving clients experiencing chronic homelessness. You'll need to look at your specific grant agreement to confirm details regarding the number of dedicated or prioritized beds. Who is chronically homeless? This is a homeless individual with a disability who lives either in streets or shelter and has been homeless for at least 12 months. This can be a continuous 12 months, or it can be episodic if it's at least 4 separate occasions in the last 3 years, and this combines to at least 12 months. Now you'll note I said a person who lives in streets or shelter, and I'm using this as shorthand. And I'll continue to be using this shorthand throughout the training. But what I mean by this is someone who lives either in a safe haven, an emergency shelter, or a place not meant for human habitation. And a place not meant for human habitation can include a car, a park, an abandoned building, a bus, train station, or airport, or a camping ground or encampment. So the McKinney-Vento Act, as amended by the HERF Act, requires that the individual or head of household has a developmental disability that manifested before the age of 22, that results in substantial functional limitations and impedes their ability to live independently and secure economic self-sufficiency, or the person has HIV/AIDS, or a physical, mental, or emotional impairment that is expected to be chronic and last for an indefinite duration and impede their ability to live independently. It must satisfy both of those conditions. The physical, mental, or emotional impairment could be caused by alcohol and drug abuse, PTSD, or brain injury. As I mentioned, the length of homelessness must be a cumulative 12 months at least, and this could be one continuous period of homelessness, or it could be episodic, but again, this must be 4 or more occasions of homelessness over a period of 3 years, and the combined occasions must equal to 12 months or more. This second part, the episodic prong, is new as per the 2016 final rule. Now we're going to cover what constitutes a break and what does not constitute as a break to help identify episodes of homelessness. So a break in homelessness is any period of 7 or more consecutive nights in a non-qualifying location. And a non-qualifying location could be couch surfing, a hotel paid by the individual, or transitional housing. A stay in an institutional care facility does not constitute a break in homelessness if the stay was fewer than 90 days and the client was homeless and living in streets or shelter immediately prior. I want to note that while the language for Category 1, literal homelessness for institutional stays, is 90 days or fewer, for chronic homelessness, it's fewer than 90 days. So this means 89 days or fewer. An individual stay in an institutional care facility counts towards the 12-month total, so long as the stay is fewer than 90 days and meets all of the necessary criteria before entering that facility. So for example, if a person with a qualifying disability is living on the streets for 10 months and they then enter an institution for 2 months, they now have 12 months of homelessness and qualify under chronic chronically homeless. A family can be considered chronically homeless if the adult head of household meets all the criteria for chronic homelessness. And if there is no adult in the family, the minor head of household must meet the definition of chronic homelessness. Chronically homeless families include families whose composition have fluctuated while the head of household has been homeless. So, for example, if a person who qualifies as chronically homeless lost custody of their child at some point during their history of homelessness, and during that time the child was temporarily placed in foster care, the child may still be considered as part of the family. And the entire family would qualify as chronically homeless even though the child was housed during some portion of the 12 months of homelessness. I also want to note that the family can determine who the head of household is. So if there are multiple adults, the family determines. If there are multiple minors without adults, the minors in the household can determine who the head of household is. In accordance to HUD's equal access rule, a chronically homeless family is any group of persons presenting for assistance together. This is regardless of marital status, actual or perceived sexual orientation or gender identity. It's regardless of whether they have children or not, and irrespective of age or relationship. And children who are temporarily in foster care are included in the family. I will note that programs can limit to households with children, however. So these are just some reminders. Chronically homeless means a homeless individual with a disability. They're living in streets or shelter, and they have been homeless for at least 12 months. This can be continuous period or episodic if it's at least 4 separate occasions in the last 3 years. You want to remember that breaks in homelessness are 7 or more nights in a non-qualifying location, and institutional stays of fewer than 90 days are counted towards their time being homeless. In response to challenges communities were having connecting their most vulnerable neighbors who did not meet the definition of chronic homelessness, or who likely met the definition but did not have adequate third-party documentation available, HUD announced in the 2017 NOFA DedicatedPlus permanent supportive housing projects. And these projects have a little bit more flexibility with who they can serve. So along with being able to serve chronically homeless individuals, you can also serve a person who met the definition of chronic homelessness, but then resided in transitional housing because there were no other options available at the time. Someone who was experiencing chronic homelessness and moved into permanent housing, but for some reason was unable to make that permanent housing situation work, and then they end up back on the streets. Someone who's been residing, who was living in streets or shelters and then stayed in an institution for more than 90 days and was then discharged to the streets or shelter. Someone who's been living on the streets or in shelter for at least 12 months in the last 3 years, but they don't meet the at least 4 separate occasions condition that you would need to qualify under chronically homeless. Or someone receiving assistance through the VA homeless assistance program that meets one of these above criteria. Now, do we have any questions that I can answer just regarding the definition of chronic homelessness? I'll give it a couple of seconds in case some of these questions are kind of lengthy to type out.
And while we're giving time for questions, I want to point out that the DedicatedPlus definition applies to projects that applied as DedicatedPlus projects. So that information, whether or not you're DedicatedPlus or whether you're dedicated chronic homeless and how many beds are chronic homeless dedicated, would all be in the project application that you applied for this grant under, and should be in your project's records of eligibility for the project.
Thanks, Eli. Okay, I'm not seeing any questions at the moment, but I will keep an eye for any questions that might be trickling in. But for right now, I want to cover our first hypothetical. So, Kai presents at your permanent supportive housing project. Exactly 18 months ago, he left his dormitory for safety reasons. His friends Joe and Cam accompanied him into the woods, where they camped every night for 18 consecutive months. Kai suffered and continues to suffer from vivid nightmares, migraines, and acute physical pain. Is Kai chronically homeless? So we're going to launch our first poll right now. And the answers would be yes, no, or we need more information. I'm seeing some answers trickle in. I'm going to give it 5 more seconds maybe. Okay, maybe 2 more seconds for good measure because I'm seeing some more come in. Okay, I'm gonna pull right. So I'm seeing most people are saying yes. And let's walk through this to see if that's correct or not. So when determining whether Kai is chronically homeless, we want to first check, are there at least 12 months of homelessness? Yes. Ooh. He camped every night for 18 consecutive months. So yes, sorry, my transitions are a bit off on that. Sorry about that. Does Kai have a disability? Here we need a little more information perhaps. We know that Kai suffers from vivid nightmares, migraines, and acute physical pain. What we'd be interested in knowing to really feel comfortable saying yes is, does this impede their ability to live independently? Now we're going to move on to hypothetical 2. Arami presents at your permanent supportive housing project. Currently, she sleeps in a sidewalk tent where she has been living for the past 10 months. Before that, she spent 14 days couch surfing with her friend Adrian after exiting a substance abuse treatment facility, where she resided for 2.5 months. Prior to that, Arami lived in transitional housing for 6 months before receiving the referral for substance abuse treatment. Before that, Arami stayed in an emergency shelter for 1 month. And prior to that, Arami lived on a raft with her friend Adrian, who was homeless at the time, but is now stably housed for 3 months. Is Arami chronically homeless? I'm going to launch our second poll at this time. Now I know this hypothetical has quite a few parts to it, and I would suggest working from the bottom up, so working from her time on the raft to her current situation, and you want to think about all the episodes and where there might be breaks if there are, and how that factors into it. Because this is a longer one to think through, I'm going to give this a few more, maybe even an entire minute to work through.
I definitely need a little more time to work through this one. It's more complicated.
Yeah. And when thinking about breaks, we want to remember what constitutes a break, what are non-qualifying locations, things of that nature would be helpful. Okay, I'm seeing some answers trickle in. I'll give it 10 more seconds, I think. Okay, I'm gonna end this and we'll walk through it. So most people said yes, that Jeremy is chronically homeless. And now we're going to walk through the steps you'd have to take and see if that was correct or not. And hopefully my transitions are synced up this time. So, are there at least 4 separate episodes that combine to at least 12 months of homelessness? The first episode lasts for 4 months. There were the 3 months on the raft and the 1 month in an emergency shelter. Then there's a substantial break. There's 6 months in transitional housing, which is a non-qualifying location, 2.5 months at a substance abuse treatment facility. The institution is, the institutional stay is included in this break because they're coming from a non-qualifying location, the transitional housing. And then the 14 days couch surfing with Adrian is a part of this break because that's another non-qualifying location. Then we have episode 2, which is 10 months sleeping in a sidewalk tent. So we see there's 14 months of homelessness, but it doesn't satisfy the definition because there aren't 4 separate episodes. And then, does Jeremy have a disability? We don't have enough information. So at the moment, Jeremy wouldn't qualify under chronic homelessness. Hopefully that clarifies. Sorry, Eli, go ahead.
Oh no, I was going to say, and I think this is a good example of if you could establish whether Jeremy had a disabling condition that met HUD's definition, this might be a good example of the usefulness of a DedicatedPlus project, because we could document at least 12 months of homelessness, but we just didn't get those 4 episodes separated by breaks. So that might be an example of a good candidate for a DedicatedPlus project.
Exactly. Thanks for pointing that out. So that's all I have on the definition, and now I'm going to hand it over to Eli.
Awesome. Thank you, Nicole. So we're going to talk about how to document chronic homelessness. On the next slide, I've just laid out, some of the requirements that HUD established in the CoC program interim rule. The rule requires that CoC-funded projects have certain written policies and procedures. And in short, what this slide says is that you have to have policies and procedures that lay out how you're going to document client eligibility, and they have to reflect HUD's rules. So those are the rules that we're about to go over. The next slide gets at one of the core rules that I'm going to be coming back to as we talk about how to do the actual documentation. And that's something that HUD calls the order of priority. They call it something like the order of priority for obtaining evidence, but really it's a preference for certain types of documentation of eligibility. HUD has a strong preference for third-party documentation. So that means it's a certification or a statement that's not from the person whose homelessness is being documented, and it's not from the person or the team that is trying to pull together the documentation. So it's not from the program staff themselves. It's from some third person or third agency that has knowledge of, and to some extent, the client's homelessness, and can testify to that, can certify to that. Third party is strongly preferred. And I use the word preference and priority, but really what this does is establish an additional documentation requirement, because you always have to try to obtain third-party documentation. No matter what the other rules say for chronic homelessness, for every piece of it, you have to try to get third-party documentation. And in some situations, you may be able to fall back to a less preferred type of documentation, like, for example, the program staff, the folks pulling together the documentation themselves, observing living conditions, or in some other way documenting that they believe the client to be homeless, or a self-certification from the individual, the client themselves. But before you fall back to those less preferred forms of documentation, not only do you have to try to get third-party documentation, you have to record your attempts to get third-party documentation. You have to write down everything that you did that in order to try to get that better preferred documentation and why it failed. Reasonable attempts to obtain third-party documentation go beyond just looking in HMIS to see if the client had emergency shelter stay records. You'd have to talk to the client about other people, other providers, or other people in the community that they interacted with that might be able to certify to their living situation at various points in time. And then you have to make reasonable efforts to contact those people who might be able to provide that documentation. And again, reasonable efforts is probably a little bit more than one phone call or one email. You just want to make sure that you're actually doing your due diligence. You don't have to call every provider in the county. You don't have to do anything sort of ridiculous and unreasonable, but it is an added documentation burden if you're going to fall back to that second party intake worker or self-certification. So I'll reference the order of priority, the preference for third-party documentation repeatedly as we go through. So next slide, please. When you're putting together documentation of chronic homelessness, there are 3 parts of the definition of chronic homelessness. So your documentation has to cover all 3 of those parts. We're going to talk separately, one by one, about documenting current homeless status. Are they in a shelter or in a place not meant for human habitation when they're entering the program? Documentation of history of homelessness, so that 12 months, and documentation that the client has a qualifying disabling condition. Next slide, please. So to help support you or whoever's doing this documentation in documenting chronic homelessness and really any eligibility for CoC programs, the CoC has created some materials that I'm going to be referencing throughout this presentation. On the slide, you see a screenshot of the CoC website, and also I've linked at the bottom where it says source to the web page where you'll find these forms. And in the bottom left quadrant, you'll see the list of eligibility verification forms. So the chronic homelessness documentation checklist, which is the second on this list, is going to be a really, really good resource for you if you're documenting chronic homelessness or if you're reviewing documentation to check for compliance. The chronic homelessness documentation checklist not only walks you through in sort of a checklist form the steps that you'd want to go through in order to establish documentation, it also, the last couple of pages of the checklist are a little mini reference guide that actually summarize most of the rules that we're going to talk about today. So this is a form, this is a guidance document and a reference document that I would recommend checking out if you haven't already, maybe even printing it out, keeping it near your workstation, and getting a fresh copy periodically as we update it. Because it can be a good quick reference for you as you're going about your day. And then forms A through F, those are the forms that you would use to actually do the documentation. The checklist is more of a guide. Forms A through F give you a form and a structure for various types of documentation that you could use to document various parts of the chronic homelessness definition. So as we move on to the next slide, we're getting into documentation of current homeless status. You're going to remember always, of course, that for current homeless status, like any other part of chronic homeless documentation, the order of priority applies here. So the options for third-party documentation are those first 2 on this list. An HMIS record showing that the client is in a shelter or living on the streets or in their car, someplace not meant for human habitation at the time of entry into the program, or a written certification from another service provider. So this could be a referral from a shelter where the client is staying, or a referral from an outreach worker who had contact with this client recently and knows that they're living outside or in their car. you can get written certification from those sources. And either the HMIS record or the housing or service provider referral can act as third-party documentation. For the HMIS record, you can just print that record from HMIS, put it in the client file in your documentation of eligibility, and that suffices. For the written certification, you probably want to use Form A. Form A is a really simple, focused way of getting, see if the emergency shelter would fill that form out for you, and then as long as you have all the pieces filled in and understand how the form works, you're going to have sufficient documentation from a third-party source, which is great. If you have made reasonable efforts to get either of those two forms of documentation and you can't, then you can document your attempts and then fall back to second-party or first-party forms of documentation. So this could be one version of a less preferred, a last resort documentation is if you, and when I say you, I mean whoever is pulling together the documentation, the staff at the program who are verifying documentation, if you can go out with the individual and they can show you, I'm living in my car, you can see that this is where I'm currently staying, or if they can go out and take you to, like, this is where I'm sleeping tonight, and you can physically observe the location where they're staying, that is a form of documentation that you can use, but it's a less preferred form. It's second party. And then similarly, self-certification. So that's just the client making a statement that, yes, I am currently staying at this cross street or in this area of the city, and that's where I'm living. So for the second party, the staff observation, you can use Form B. This is a form that is specifically designed to record staff observation. And for the self-certification, you can use Form E. And note that both of those forms have a backside. There's a backside to the form that is the place where you can record all of those attempts that you made to find third-party documentation. It's built into the form. You just have to fill it out because recording your attempts to find third-party documentation is part of the documentation requirement. And then one last quick note about current homeless status. The intention here is to document where the client is staying, where they're living, at the point of enrollment into the program that requires chronic homeless eligibility. At the point of enrollment, to document this, the documentation can actually be dated anytime within 14 days prior to the date of enrollment. So it doesn't necessarily have to be dated the night before. If you're looking in HMIS and you can find a shelter record from 3 days ago, that's probably going to be good documentation and third-party documentation of current homeless status. One of the things that you want to keep an eye out for is in your client file. It's one of the things we often see is dates of entry or dates of enrollment are recorded differently on different pieces of documentation in the client file. So maybe one person is doing an assessment and the other person is doing the intake agreement, and the dates of enrollment are noted slightly differently. That can be a little difficult, can be challenging when you're trying to work back from that date of enrollment to make sure you're in the 14-day window. So that's just a plug for try to be super consistent with the details in the client file. That's all I have to say about current homeless status, but I want to pause and see if anybody has any questions. If you have a question, go ahead and type it in. If you don't have a question, if you could go to the chat and just type in no, that would be awesome as well. So any questions about current homeless status? No questions? No? Awesome. All right. Great. Excellent. Thank you all so much. I see no questions. No. Great. Good. Thanks for checking in. I also just wanted to make sure that we pause my babbling for a minute to let you process all of the information we're throwing at you. So the next piece of the definition is history of homelessness. This is going to be a long section because there are a lot of different options for documenting history of homelessness. So bear with me. The next slide gives you a bit of a sense of that. So these are all options for documenting history of homelessness. And actually, these are just the third-party options. So you'll see there's a lot more than just the two that you had for current homeless status. These third-party options include, an HMIS record or a written referral from a shelter or an outreach provider, which you'd use Form A to document. That's going to look pretty much the same as it does for current homeless status. But you also have 3 other options for third-party documentation of history of homelessness. We'll get a little bit deeper into each of these in future slides, but I just want to quickly note you can get an observation by any community member of where the household was living at a point in time in the past. There's a form for that, Form B. You can get a certification by a housing or service provider in their professional capacity, which is a little bit different from that shelter referral. That's Form C. And you can also get a physical observation. So if you, as program staff, or the person doing the documentation, normally always for a current homeless status, that program staff is less preferred. It's always second party. But in some situations, when you're documenting history of homelessness, the actual staff doing the intake, the staff doing the documentation, you can use your own observations of past homelessness as third-party documentation. As I said, we'll get into all this, but just know that the things that qualify as good documentation for history of homelessness are a little different from current homelessness. And then if we go to the next slide, this one breaks down those less preferred forms of documentation for history of homelessness. So again, second party documentation, that's program staff documentation, or the folks pulling together the documentation to establish eligibility. Some forms of documentation by staff are second party, and I'm going to go into this distinction really, I hope, clearly later on. But just know that sometimes if the documenting staff, the program staff, are certifying to homelessness, sometimes that can be third party, sometimes it's not, it's less preferred. And then, of course, first party documentation, self-certification, that works very much like it does for current homeless status. So the next slide takes us into some other general rules about documenting history of homelessness. If you have third-party documentation, so third-party documentation is not just great because HUD prefers it. HUD actually gives you some incentives and makes third-party documentation work for you a lot more than other forms do. If you have third-party documentation of just one night of homelessness in the past, you can use that one night of homelessness to document an entire calendar month. So for example, if you see that there's a shelter record of a shelter stay for this client on September 10th last year, you can use that one shelter record as documentation of the entire month of September, which is super convenient because you don't actually have to go and hunt down every day of those 12 months. There is an exception to this. So if you have evidence in front of you that there was a break in homelessness during that month, then you're not going to be able to ignore that and include the entire month as part of your history of homelessness. So that would be if you have evidence that you're looking at of at least 7 days in a non-qualifying location, then this 1 day equals 1 month isn't going to work quite the same way. So in our example where you have someone who had a shelter stay on September 10th, if you're looking in HMIS, and because you're in HMIS, you can see that they had a transitional housing enrollment that started on September 15th, 5 days later, and lasted the rest of the month. For example, that's a transitional housing stay. It's longer than 7 nights. It's 7 nights or longer. So it counts as a break. Then that 1 day of homelessness on September 10th can document just up until that transitional housing stay. So the first 15 days of the month. And then you're going to have to, you can add those 15 days into your 12 months, and you're going to have to find some days other places to get the full 12 months of homelessness. But generally speaking, 1 day, 1 month. The next slide gets into some other ways that HUD deprioritizes second party and self-certification. So generally speaking, for the chronically homeless clients that you're documenting or whose documentation you're reviewing, for a particular program, for just generally every client, you can document up to 3 months of their history of homelessness using second or first party, so self-certification or program staff documentation. You still have to try to get third party, and you still have to document that you tried and failed, but you can fall back to those less preferred forms of documentation for up to 3 months. But 9 months, at least 9 months of the history of homelessness must be documented with third party documentation. So at this point, it's not just a preference, it's a requirement that at least 9 months be documentable by third party documentation. Again, there is an exception to this. There's a little bit of flexibility. So for up to a quarter of the total households that you serve over an operating year can be fully documented with less preferred forms of documentation. So you could do up to a quarter of your clients in an operating year without any third-party documentation. This is really important to keep an eye on at the program level. Someone should be tracking this, like every client where you exceed that 3-month cap on less preferred forms of documentation should be tracked, because it's really easy to lose sight if you're only looking at this from the level of individual case managers. It's really easy to lose sight of how many, what proportion of your clients you're going to have exceeding this 3-month cap. And it's really important you don't go over that 25% limit. So really pushing to try to get third-party documentation for at least 9 months for most clients is going to be the way to go. I want to note that this particular limitation, like the 3-month cap on documenting history of homelessness with less preferred documentation, only applies to the homeless episodes themselves. You're free to fully document all of the breaks in homelessness with self-certification, provided you can demonstrate that that was the only form of documentation you could find. There's no limit on the amount of self-certification you can do for breaks, which is handy. Okay, so that was a lot, but I'm not seeing anybody jump any fun questions in the chat. So we're going to move on to the next little section here, which is going to get into what those specific forms of documentation for history of homelessness look like. I went over them really quickly, the ones that are a little bit different from current homeless status, but we want to talk about what does it actually look like when you do these. So for those housing and service provider certifications, this, for history of homelessness, that category of housing and service providers who can do a certification is pretty broad. You can get a certification for history of homelessness from a healthcare professional who worked with your client, an educator, a law enforcement officer, even if that feels okay and a safe place for you to reach out to for your client. Any person who interacted with your client in their official or professional capacity providing services. So this wouldn't be a nurse who is walking home from work and struck up a social conversation with your client, but this would be maybe a nurse who was providing medical care or screening for your client and had a conversation with them. The next slide is going to show us the different ways that you can work with a housing or service provider to get certification that counts as third party. So if the housing or service provider physically observed, so saw with their human eyes, where the client was living at some point in the past, they can fill out an observation of living conditions form, which is Form B, if they're willing to do that for you. And they'll just need to describe where they observed the client staying and how, just, they could tell that the client was staying there. And of course, that would need to be the living situation would need to be a place that is a place not meant for human habitation or even potentially a shelter. If the professional did not observe the client's living situation, they didn't go out and meet them where they were staying, but they had a conversation with the client, maybe in their office or just in another location. And through that conversation and that interaction, based on the client or the professionals, the housing or service provider's professional judgment, they could tell, they knew that the client was homeless, then they can fill out Form C. So this would be, the example of the nurse. The nurse is talking to the client. They're not doing medical outreach. So they're not out in the encampment. They're in the clinic, and based on what the client is describing about where they're staying, difficulty maybe managing medications because they're living outside, or whatever context that information comes up in, that professional can say, well, yes, I had this conversation, and in my professional judgment, it was clear that this client was homeless at this time. Using either Form C or Form B, you want to make sure that you get a clear statement from the provider of the time, so the date that they interacted with the client, the approximate date. But it's good to get the date if you can, and definitely have them approximate the date on the documentation that they're filling out. And then because it's third party, you can extrapolate from that date to the entire calendar month, but it's important to have that approximate date. Okay, so the next slide takes us into community member certifications. Again, this is documentation for a history of homelessness, not current status, but history of homelessness. You can talk to any member of the community who had knowledge of the client's living situation at some point in the past. It can be any community member, but that community member needed to have physically observed, again, with their human eyes, where the client was staying. So this can enable you if the client tells you, yeah, I talked to a business owner in this strip mall near where I was staying every day, and we talked about how I was doing. Or there was a neighbor who passed by who could probably tell you and describe to you the fact that I was living in this situation. There's any community member out there who can do that. You can try to reach out to them, you can find them, and get a statement from them. You can either have them write it down, which is probably easiest. Well, in some situations, it could be easiest, or you can talk to them on the phone, and then you can write down what they're saying to you. You can record that oral certification. And then you just have a responsibility to use your professional judgment to decide whether you think that community member is a reliable source. The next slide gives you a little preview of the Form B, observation of living conditions, that you would use with the community member. This observation of living conditions form is the same form you'd use with a housing and service provider if they're documenting their physical observation. It's the same form. You want to make sure that you have a location as precisely as you can get that the client was observed staying in. A just brief description of the living conditions. So were they sleeping in a car? Did they have a tent? Were they out in the open? Something to demonstrate that the situation was observed. And then the approximate date. So for community members, you want them to get it within the month. An approximate date is best, but you definitely want them to specify the month that they observed the client staying in that situation. Okay. Any questions about community member certifications? Okay, don't see any. So going on to the next slide. this is where we're going to break down program staff. Now, program staff that refers to the program that the client is trying to enroll in, the staff who are actually doing the documentation. As I mentioned, for history of homelessness, sometimes this can be third party, sometimes it's second party. I'm actually going to skip on to the next slide because I think it breaks it down pretty clearly. So if you, meaning the person doing the documentation, is describing a living situation in the past that you observed in the past. A month ago or a year ago, you were out talking to this client where they were living in a place not meant for human habitation or in a shelter. You can actually fill out the observation of living conditions form for that past interaction, Form B, same form we were just looking at. If sometime in the past you had a conversation with the client, just like any other housing or service provider, you can use Form C to certify their homelessness based on your professional judgment, based on some encounter you had with them in the past. So maybe they came into a drop-in center a couple months ago and you had a conversation and it was clear to you from that conversation that they were living outside or living in a shelter. So you can fill out that certification based on professional judgment, Form C, and that counts as third-party documentation. The second party documentation situation here is if the intake conversation, so at the point when you're trying to establish this documentation, that's the only interaction you had with the client. They're describing their living situation 3 months ago at the point when they're enrolling in the program. And you can tell based on the things that they're describing that they were homeless at the time. So you can certify to that in your professional judgment. You can use Form F to do that, but that's second party, that's less preferred documentation. So you need to try to get better documentation first. And then in some situations, for up to 3 months of homelessness, you can fall back to this less preferred form. And then the next slide gives our final form of documentation, which is first party. I'm not going to go into this a lot. I think that we've talked about this under current homeless status, but it's just the client is filling out Form E to certify their own homelessness, and you are also filling out Form E to show that you couldn't get more preferred forms of documentation. The next couple of slides actually show you that self-certification form. We're going to flip through them, but you'll see that this slide shows the first slide shows the first side. There you go. And then the next slide shows the second side of the form, which is your staff supplement. Make sure that the full form is filled out there. All right, next slide. So this we're going to get into documenting stays in institutions really briefly. We know that unfortunately the clients that we're serving often are in and out of treatment centers, hospitals, jails, prisons. These are all institutional situations. And to documenting stays in institutions is a very important part of telling that full story of a client's history of homelessness. So the documenting stays in institutional care facilities that are less than 90 days, if it's fewer than 90 days stay, those 90 days may be included in the total history of homelessness, the total 12 months, as long as you have evidence and can document that the client was in a place not meant for human habitation or a shelter, one of those qualifying locations, immediately before they enrolled in the care facility, in the institution. So that would be any of those forms of third-party documentation that we talked about to document their homeless status right before they enrolled in the institution. And then evidence that shows the length of the stay, because you're trying to document clearly that it was less than 90 days. Next slide, please. Yeah, so documenting the length of stay in that institution, right? You know they were homeless when they went in. You want to get ideally some discharge paperwork, but it has to clearly include start and end dates of their stay, so you can show that it was that less than 90 days. Or you could get a written or oral referral or statement from someone who works at that institution who had knowledge of the stay. And that statement would just have to clearly show the start and end date of the stay. Because again, you're trying to document with third-party documentation that the stay was less than 90 days so that you can include it in the history of homelessness. And then when you can't get either of those preferred forms of documentation, you need to show that you tried. You need to have that written record of your attempts to find that. And then you can fall back to have the individual self-certify that their start date at the institution and their end date, and just tell you about how long they were there. So the next slide gets into another form. Oh, and just about the stays in institutions. You're trying to document fewer than 90 days if you're trying to include that in the history of homelessness itself. If any stay in transitional housing longer than 90 days is going to be a break in homelessness. So the next slide shows us a different type of break in homelessness. A stay in transitional housing that is longer than 7 nights or more, I should say, is a break in homelessness. One minor exception to this is if a veteran has been assessed in the VA system and the VA system has documented their chronic homelessness at intake to a VA-funded transitional housing facility or at intake to the VA system in general. If they stay in, say, a GPD transitional housing program for longer than 7 nights, they actually retain their chronic homeless status. But for any other client in any other form of transitional housing, 7 nights or more is a break. Now, that's not necessarily a bad thing because sometimes you're trying to document those breaks to get your 4 episodes of homelessness. And speaking of documenting breaks, the next slide gets into exactly how you do that. So documenting a break in homelessness can be done through an HMIS record. You can show an enrollment in a program, or maybe that a client was actually housed through permanent supportive housing or rapid rehousing for a certain period of time. You can get a written referral by a housing or service provider that certifies to that as well. You can have a written observation by an outreach worker. Maybe the outreach worker was working with the client while the client themselves was paying for a hotel room, or while the client was actually had moved in with a friend for a bit. The outreach worker was still in contact. And if you can't get any of those third-party forms of documentation, you can always fall back to self-certification. As long as you document your attempts to find better documentation, there's no cap on the amount of self-certification you can do when you're documenting breaks. Okay, we're going to pause just very quickly for a quick quiz on the stuff we've talked about so far. The next slide lays out a scenario for you. So, deep breath. To help document a new client's length of time homeless, you obtained a written statement. So it's written, that's great, from someone in your own agency's outreach team. The statement says that this outreach specialist spoke to the client on July 23rd, and they observed the client's sleeping bag and their personal items just off the path near Guadalupe Creek. So my question to you in the poll is, what type of documentation do you think this is? Would this be useful at the second party, third party? Is it self-certification, or is it none of those? All right, so remember, you're documenting length of time homeless, that's history of homelessness. It's an outreach worker on your agency's outreach team. They observed where the client was sleeping. So does this sound like second party, third party, self-certification, or none of the above? I'm going to give you some time to ponder that, noodle on it for a bit. Seeing some responses coming in. Yeah. Great. All right, I'm seeing people are picking up on some good clues. Excellent. Okay. Going to give you a little more time to get those answers in. 3 more seconds. All right, I'm going to close the poll and we're going to take a look. So I actually love the range of responses that we got because I can tell you're looking for the right things. And at this point, that is what we want you to be doing. You don't have to be perfect at this right now. This is a really whirlwind presentation. So what I think you're seeing is that this is a statement from the agency's own outreach team, right? And we've talked about if it's the staff who are doing the intake, doing the documentation, sometimes that can be second party. In this case, this documentation would be third party for a couple of reasons. First, something that I didn't tell you, but I wanted this scenario to point out, is that if your agency has an outreach team that is separate from, like, maybe your PSH program, you're trying to document eligibility for that program, but you just happen to have also at your agency a separate outreach team, and they do outreach, and they're not part of your PSH program, and they're not funded by it. That agency outreach team is always going to be able to do third-party documentation, just like any other outreach team. When we talk about second party, that is the staff and the team and the PSH program that is doing the documentation review. That's a general rule. It's always good when you have a scenario like that that's a little more gray to reach out to home base to ask, would this be third party? But most of the time it's going to be third party. And the other thing to note is that we're talking about history of homelessness. And for history of homelessness, even if the outreach team was if the outreach team themselves were responsible for pulling together this documentation, so they really are the program staff doing the documentation, even in that situation, because they're talking about something that happened in the past in terms of like history of homelessness, and they met with they saw the client, they observed the client's sleeping bag in the past, trying to document some part of this history of homelessness, that can work as third-party documentation always, even if it's the program staff themselves. Okay. So thank you so much for thinking about that and putting your brains to it. I hope that was helpful details. So the last piece of documentation we're going to talk about is documentation of disability. We're all done with the rules about a history of homelessness, thank goodness. So looking at a disabling condition, you have some options for documenting a disabling condition. You can get written verification from a professional, as long as that, a medical healthcare professional, as long as that healthcare professional is licensed by this state, so in our situation, California, to diagnose and treat the particular disabling condition. If you can't get that, or if it's easier to get something else, you could use a written verification or written statement from the Social Security Administration that the client is eligible for disability benefits. So this could be a letter of confirming eligibility, any statement from the Social Security Administration clearly stating the client's eligibility for disability benefits. You can even just use a disability check that the client has received sometime in the past for SSDI or maybe Veterans Disability Compensation, one of those federal disability benefits programs. And any of those three things would count as third-party documentation of a disability. The general rule, and what is true most of the time, is that if you can't get this third-party documentation of a disability at enrollment, you can do a staff observation. You interact with the client, and you can say, okay, based on my interaction, my observation, in my professional judgment, this client clearly has a qualifying disability under one of those categories that Nicole went over. And then if you can, just record that observation, you make that statement, sign it, that gives you 45 days to try to get to backfill this third-party documentation. You still have to go out and try to get verification from a professional, maybe connect your client to a medical care professional who can make a diagnosis, or hunt down the disability check that the client knows they have but can't find. And in that situation, you have 45 days. Now, I want to note here that in response to the COVID-19 pandemic, HUD has made available a set of temporary waivers of certain CoC program requirements. And there is a specific waiver that's available to all CoC funded agencies of the third-party documentation requirement for disability. So you'd have to notify HUD that you were using that waiver, and you have to have a good reason to need to use the waiver for a particular client. But if you're implementing the waiver, then you could just use staff observation in that case for a time-limited period in response to COVID-19. The next slide gets into some specifics that you should think about when you're using a verification, like a letter from a professional licensed by the state to diagnose and treat. That letter has to clearly document and verify either a diagnosis of HIV or AIDS, a developmental disability diagnosis that meets HUD's definition, or a diagnosis of a disabling condition that meets HUD's definition. So has to be included in that letter from the medical professional that it's going to last for a long time. It's going to be, it's chronic, and that the condition substantially impedes the individual's ability to live independently. So it can be really helpful to just, there's actually a documentation form on this for this. It can be helpful to just give that form to the medical professional if they're willing, because that allows them to just check boxes that will make sure that their response meets these requirements. All right. That is what we have for the actual documentation requirements proper. So going on to the next section, the next slide just has some notes about documenting chronic homelessness for families. As Nicole mentioned, you're going to document chronic homelessness for the head of household. It's the adult head of household, or if there's no adult in the family, there can be a minor head of household. Next slide. So these next couple of slides just summarize for you the key takeaways. So if you have third-party documentation, 1 day equals 1 month. If you're documenting a break to get those 4 episodes at 7 or more nights. You always need to try to document homelessness with your best evidence, so third party. Next slide. And then where you can't get third party, you have to show that you tried, but then you have up to 3 months that you can use self-certification. And then just to note that you should, at a program level, you should be keeping these records for at least 5 years from the end of the grant. So these should stay in the client file. Okay, I am almost ready to let you go and have some fun with Monica for the last part of the presentation, but I have one more quiz for you. Okay, so everybody ready for a quiz? I don't have one more quiz for you because this is the same quiz as before. So congratulations, you got out of the pop quiz. We've canceled the pop quiz, and you don't have to stress about that anymore. It's my gift to you. So that's everything about the. Oh, it is a different question. Yes, I'm sorry. This is the same scenario, different question. I'm sorry. The pop quiz is back on. It's just an emotional roller coaster up in here. Thanks for bearing with us. So my question here, this is actually the same scenario, right? And we've established in the last quiz that when you get that written statement from someone on your agency's outreach team, that the outreach specialist observed the client in their living situation on July 23rd, we established that that is third-party evidence for a number of reasons. My question to you now is, what period of time does this statement document? So does this just document homelessness for July 23rd? Does it document homelessness for July 22nd through 24th, right around that night? July 23rd through August 23rd, so 1 month there, or all of July? Right, so remember, we're talking about third-party documentation. We have documentation of 1 day of homelessness on July 23rd. How much homelessness can you use that to document? Right. Yeah, I'm getting some good mix of responses here. I have a couple minutes to to let those roll in. Remember, there's no risk here. You're not risking anything. Any answer you give is going to give me a good basis for making the learning point here. Think about, you have 1 day. How much does that document? All right, so I'm going to end the poll here in about 2 seconds, and we're ending it. Okay. Yes, we have a good mix of responses here. So this, actually, I'm going to roll it back a couple slides, Nicole, to the first takeaway slide right there. Yeah, so this is a good example of where 1 day of third-party documentation can document 1 calendar month. You have third-party documentation of July 23rd. So the answer here is that actually documents all of July, provided you don't have evidence in front of you of a break sometime during July, right? So when we say 1 day equals 1 month, that's the calendar month that that date is in. So whether it's July 23rd or July 2nd, it's going to document all of the calendar month of July. Okay, so I'm glad I didn't brush past that poll. I hope that was clarifying of that point for you all. And with that, I'm going to pass off to Monica for the final section of our presentation.
Great, thank you, Eli. Okay, and thank you all for bearing with us today. I'm gonna just take a brief stretch break, sort of shake it out. In the last bit of today's training, we are going to tie together what we've been learning from Nicole and Eli, and hopefully get you ready to return to your work with a bit more knowledge and tips and tricks. So let's get started. And if you attended our previous training on categories 1 through 4, these will look a bit familiar to you. So to start here on documenting homelessness, some tips and tricks regarding timing. You want to document where the client was living at all times, including occasions of homelessness and breaks. And remember that breaks in homelessness may be documented entirely based on self-report by the individual who's seeking assistance, as Eli explained to us a bit ago. The individual must have a disability at the time of project entry, and make sure that you've covered current homeless status, which can be met with documentation from within 14 days of program entry. Let's go ahead and go to the next slide and talk about details and organization. These are key. When HUD comes to monitor, it's a human who's coming to monitor, and the easiest and fastest way for them to get the answers to any questions they have, the better for all of you, so that you can get back to your important work. As much as possible, you want to keep case files easy to read and user-friendly so that reviewers can navigate them quickly. You can use tables of contents and tabs in the case files, so that way when a monitor comes, they can flip through and not have to look through the entire client file and potentially find other issues or have other questions. They can just get straight to the kind of information they're seeking. You want to include as much detail as possible with each piece of evidence that you include in clients' case files. And you want to tell a complete story. Telling a complete story includes, as I mentioned, documenting where the client was living at all times and explaining any gaps that are in the timeline, such as if the project lost touch with the client for any period of time. Gaps in the timeline are totally understandable, and one way to explain a gap is to include a cover letter in the client's file. Kind of similarly to if you have a gap in your resume and you include a cover letter to let the folks know what happened in that time, anticipating any sort of follow-up questions that there might be. So to bring it all home, you want to watch out for any details that undercut your evidence and document your efforts to resolve any conflicting details that could undercut the evidence that you're relying on to establish your client's eligibility for your program. On the next slide, we'll just quickly remind ourselves of HUD's order of priority. The first priority is third-party documentation. To the extent that third-party evidence is made up of oral statements, you want to document them in writing to make sure that everything is included in the client's file. The second option is intake worker observations. And the third option, as a last resort, is certifications from the client. And again, we want to back up any second or first party evidence with documentation of efforts to obtain third party evidence. So at this point, between two trainings, we've spent more than 5 hours talking about eligibility categories and documentation, and that's just at a basic level. This stuff is really complicated. So it is possible that there will be an instance where a client's documentation is not compliant. Maybe a client was transferred to your project, maybe your agency has taken on a new project. In the event that documentation is not compliant, there are actions that an agency can take to address it. We want to flag here that OSH is an excellent resource. The Office of Supportive Housing has a lot of experience with these sorts of issues and can be a great resource to troubleshoot and come up with a strategy. You want to develop a plan to bring the program into compliance and backfill or remedy documentation for as many active clients as possible. There are also instances where we would recommend reaching out to the HUD field office. They're humans too, and they totally understand. And especially if you've got a plan to remedy the documentation, it can be really great to be proactive in reaching out to let them know what's going on and your plans to remedy that before your next monitoring visit. Going on to the next slide. Again, this is all complicated and clients do move between programs. If a current client is found to be ineligible, there are, again, steps that a program can take to work with the household and come up with a plan. The last thing that we want is for the client to return to homelessness. And so as much as possible, you want to work together with your team to find out things that can be done, such as transitioning the client, or again, backfilling any documentation to fill in the client's file and find out what services the client can still work within. So that was a lot. We want to pause here again to see if there are any questions. And I'm going to peek over at the chat to see if we've got any questions before we move on to applying what we've learned with some hypotheticals. Okay. Let's go ahead and move on to some practice scenarios then. We are going to do this first one together and we're not going to do a poll yet. So let's just talk this one through. Richard entered your PSH project on January 31st, 2020. His case file contains the following: oral statements made by outreach workers, recorded by your intake staff, which describe Richard's living situation on the streets of San Jose for a period of 11 continuous months, from February 2019 to December of 2019. The case file also contains intake staff observations of disability attached to a Social Security disability check dated 31 days after Richard's entry into your project. And finally, an HMIS record that an outreach worker made contact with Richard in the parking lot of a Burger King in Gilroy on January 15th, 2020, when he was sleeping in a nearby tent. So we want to pause to ask ourselves whether Richard's documentation is sufficient evidence of chronically homeless status. So while we hang together on this slide for a bit, and you review these facts, I'm going to remind you of the 3 prongs of chronic homelessness. First is a homeless individual with a disability. Second, that the individual lives in a place not meant for human habitation, safe haven or emergency shelter. And third, that they've been homeless for at least 12 months. So let's go ahead and go to the next slide and work through these different prongs together. So first, does Richard have a disability? And we know that yes, he does. He's got an SSDI check within 45 days of program entry. Next, has Richard been homeless for at least 12 months? And we know that yes, he has been for 12 continuous months. For 11 months, he was living on the streets of San Jose, a place not meant for human habitation. And we know that through third-party documentation by outreach workers' oral statements, which your intake staff then recorded in writing. Then we know that on January 25th, he was sleeping in a tent near the Gilroy Burger King parking lot, which is also not meant for human habitation. And given that we have third-party documentation via an HMIS record, documentation of that one day counts for the whole month of January. So we know that Richard has been homeless for 12 consecutive months. So it looks like Richard is possibly chronically homeless. The final piece that we would need to know is where he's living now. By where he's living now, we mean his current homeless status, which can be covered with documentation from within 14 days of program entry. The most recent information we have is that he was homeless on January 15th. The rule about the one day of documentation applying to the whole month works for documenting duration of homelessness, but it doesn't work for documenting current homeless status. January 15th, the day for which we have documentation, was 16 days prior to his enrollment to your project on January 31st. So since that's more than 14 days, we would need more current documentation of his current homeless status to determine whether he qualifies as chronically homeless. So that was a lot. Feel free to let me know if you've got any questions. We're going to take things step by step and do another example together.
Monica, forgive me for interrupting, but I really like that example and the way you framed it, because we can't say that this person does not qualify, is not eligible, is chronically homeless. We just need to do a little more digging and try to get that documentation of current homeless status that's within 14 days. So it's a good example of a place where you're not quite there yet. You're just not quite done with the job.
That's a great point. Thanks for pointing that out, Eli. Awesome. Cool. Let's see if we've got sufficient documentation for our next hypothetical. So Grace entered your PSH project on June 1st, 2020. Her case file contains the following: HMIS records that Grace stayed in an emergency shelter before living on the streets for a total of 10 months between March and December of 2019. The file also has evidence that Grace couch surfed with her boyfriend for 5 days, and Grace's own statement that for 2 months from December 2019 to January 2020, she stayed at her cousin's house. The file also has a written referral by a caseworker stating that for 4 months, from February to May of 2020, Grace slept in a tent near a Caltrain station. And HUD-approved documentation that Grace has post-traumatic stress disorder. So our question here again is Grace's documentation sufficient evidence of chronically homeless status? I'm going to launch the poll here, but I'm going to give you some time to review the facts. Sometimes when there's different episodes, it can even help to write things out, to sort of think through the timeline. And while we do that, I'll remind us again of the 3 prongs to establish chronic homelessness. The first prong is a homeless individual with a disability. So we'll look at the facts as we've got them to see if we've got documentation that Grace has a disability. The second prong is living in a place not meant for human habitation, safe haven, or emergency shelter. So that's where we'll want to revisit our facts to see the most recent documentation of where Grace was living. Finally, and this is going to be the tricky part, the individual has to have been homeless for at least 12 months, either continuously for 12 months or on at least 4 separate occasions in the last 3 years, as long as the combined occasions equal 12 months. And we'll remind ourselves here that breaks in homelessness must be for 7 or more nights. I'm seeing some responses trickle in, but I know that we want to think this one through, so we're going to give ourselves some more time here. Great, we're seeing some more coming in. We'll give ourselves a little bit longer. Yeah, go ahead.
Calculating those, trying to find those 4 episodes and the breaks are really, it's I don't know, it's like a forensics exercise or some sort of mystery that we're solving.
Yeah, no kidding.
Putting the clues together.
Awesome. We're just under 50%. I want to see if we can get to 50% responses. We'll give you a couple more seconds. And as a reminder, this is all anonymous. Okay, great. I'm going to go ahead and end the poll. So we've got a little bit of a split board here with just over half the folks leaning yes and just under half folks leaning no. So let's go ahead and talk through it element by element here. So we can start with, does Grace have a disability? Yes, she does. She's got post-traumatic stress disorder that's verified with HUD-approved documentation. Next, has she been homeless for 12 months? So here's where we're going to talk through the timeline. So she hasn't been. There's only 2 episodes of homelessness. We've got HMIS records that Grace stayed in an emergency shelter before living on the streets for a total of 10 months between March and December of 2019. So that's our first episode. Then she couch surfed with her boyfriend for 5 days, which does not constitute a break in homelessness because it was for less than 7 days. Then for 2 months, she stayed at her cousin's house, which does constitute a break. So then her second episode of homelessness was sleeping in a tent near a Caltrain station, a place not meant for human habitation, for 4 months. Again, the rule for chronic homelessness is being homeless for 12 months, either continuously or for at least 4 separate occasions in the last 3 years, as long as the combined occasions equal 12 months. Because Grace has neither been homeless for 12 consecutive months, nor for the at least 4 separate occasions in the last 3 years, she does not qualify as chronically homeless. Given that Grace doesn't meet this second prong, we know she doesn't qualify as chronically homeless, but just to round this out, we would also need to check for documentation of current homelessness. So that one was pretty complicated, and we just wanted to sort of bring home documenting the various episodes and focusing on that timeline and those breaks. The last hypothetical that we have for you today is about Jordan. Jordan entered your PSH project on November 22nd, 2019. His case file contains jail records for 2 months from June 21 to August 21 of 2019, written verification from a prison counselor that Jordan has a disability, and written observations by various case and outreach workers, stating that immediately prior to his booking at the jail, Jordan spent 10 continuous months sleeping in emergency shelters and otherwise living in the streets around Santa Clara County. So again, we ask ourselves, is Jordan's documentation sufficient evidence of chronically homeless status? We're coming to the end of our time together today, so I'm going to skip the poll and just go on to our next slide to talk us through the various elements. Has Jordan been homeless for 12 months? Yes, for 12 continuous months. Jordan spent 10 months in an emergency shelter and otherwise living on the streets, as documented by written observations from various case and outreach workers. Institutional stays of fewer than 90 days are counted as time homeless. Jordan was in jail for less than 90 days and was homeless when he entered jail, so his 2 months in jail count as time homeless. So these 2 months plus the previous 10 months get him to 12 months of homelessness. Regarding whether Jordan has a disability, we know that a prison counselor has written that he does. However, we don't know whether the prison counselor is state certified or whether that certification indicates that the disability is of a long continuing or indefinite duration or substantially impedes his ability to live independently. So we need additional documentation to determine whether he has a disability that would qualify him for chronic homelessness. In addition to having insufficient documentation of the disability prong, we don't have documentation of his current homeless status. The last documentation we have is from his time in jail, which ended on August 21, and he didn't enter the project until November 22. So we do have a gap that would need to be addressed if we were to try to demonstrate he qualifies as chronically homeless. All right, we're just about at time. Thank you again so much for your time and participation today, and thank you again for the incredibly important work that you do. Please feel free to be in touch if you have any questions regarding the topics we covered today. We know we covered a lot really quickly, and we are here to be a resource for you. You're going to be receiving a feedback survey after this training. Thank you in advance for your time and your feedback. We do review it and we make changes based on your feedback, especially lately as we've been transitioning from in-person to online trainings. We really value it to improve our trainings and to make them as useful as possible for you. Thank you all so much, and we hope you have a great day. Take care.
Thank you, everyone.